The injections, are they almost like a cortisone injection where you do a series of 3, or how does it work?
It's a collagenase inhibitor, so those break up collagen. This is collagen buildup. This is plaque buildup, scar. And so the medications involve 2 shots every 6 weeks. So they come the first week, they come to my office, and I give them an injection right into that plaque that's causing the bend. And so that medication is meant to break up plaque. During those 6 weeks, and you can do 4 cycles, so it's 2 shots every 6 weeks for 4 cycles. That's a total of 8 shots. During that time period, I have patients mold or actually bend their penis opposite the actual curve to try to straighten out the penis. And that's not part of my protocol. That's part of the major protocol that was used for the actual. That sounds painful, though. The curving, the bending isn't that bad. The injection, people tolerate it very, very, very well. Okay. And there have been certain studies. I looked at my own data for the last 2 years, and I saw a significantly better improvement in curvature in my patients with XIAFLEX. So it's a great option.
Absolutely. Now let's get into the surgical options for patients that they have for this condition. The first is grafting. So what exactly is grafting?
Right. So there's 3 major treatment options. I would say the grafting is definitely one of the mainstay in the treatments of Peyronie disease. Grafting involves finding that plaque in the penis, cutting out that plaque, and then grafting it or using a piece of a biological tissue to patch that hole that you've essentially made once you remove that defective portion of tunica.
But wouldn't that plaque build up again?
It can. It can, and that's part of the counseling. You need to be able to tell your patients that none of these treatment options are perfect. They all carry their risks. And yes, of course, remember I told you this is a disease of trauma, and so grafting can also cause some plaque buildup. But it is definitely a treatment option that's been around for a very long time.
Okay, the second is plication?
Plication. So the concept behind plication, and I said this is scar. So let's say you have, in my finger, the plaque is right here, and so the penis is bending upwards because your scar is right there. Well, if you plicate or make an actual, throw some stitches opposite to that plaque, so the other side of the penis, and you plicate by throwing stitches, or what are you going to do? You're going to tether it this way, and you're going to straighten out the penis. So plication is you plicate opposite the side of the curve, and that plication will straighten the penis out as well.